Time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Today, we're going to be introduced to a team member of Dr. Meyer's, and that's Dr. Nick Larson. Dr. Larson, chiropractic care at Okoboji Wellness Clinic. And slide up nice and cozy to that mic, Dr. Larson. Well, if you would, tell us a little bit about yourself. When did you come on board?
Yeah, so I've been there a few months now, and I really do feel like I'm just getting started there. Just in what I'm doing, and kind of how I'm trying to build things, and then really the team effort that we have there too. We've got a lot of really good team members that I think the whole picture, once you put us all together, that's kind of what makes us different.
It does make you a little bit different because you can, of course, go with the care of a traditional medical doctor with Dr. Meyer, although I'm not certain I want to put him in the camp of a traditional medical doctor. But
Yeah, I think you can get information, and then it's how you interpret that information, and then how you motivate people or guide people towards health, greater health.
Yeah, he certainly does carry that traditional medical license, but that does not mean he's not going to search out different ways that might, instead of just putting a Band-Aid on your problem, he really is searching out to try and, for lack of a better term, cure your ailment so that you can function much better.
But we're definitely looking for the root cause and trying to promote health in the best way possible. And the way that I see myself fit in is really alongside our, we have a couple massage therapists that are really good at the soft tissue side of things. So I really see myself as more of musculoskeletal, spinal cord, brain, nervous system, and how you really function throughout the day.
So what made you think that you would be a good fit with the team at Okoboji Wellness Clinic and with Dr. Meyer?
Yeah, so this clinic, the heart of the clinic, you can just tell that people really care. So I think that is what drew me to them. I've sent some family members there that have been really helped. So, I mean, I can't speak more highly of Dr. Meyer. I really trust him. And so, yeah, his mind it's really been fun to get to know him, because the way his mind works towards health and wellness is in the same way that mine does, but we are looking at different things sometimes. So we complement each other really well, I think.
We're going to get into more of what you're doing at Okoboji Wellness Clinic, but I want to touch on, you mentioned a key word in my mind for what we've been through over the last 4 years, just how important the word trust is, to be able to trust someone in your medical care. It's a big deal.
Yeah, and I think that starts with listening, and I think that's one of the things that we're really good at. Is we want to hear your story and hear where you've been and where you want to go, figure out what your goals are, and then help you reach those goals.
So let's talk about chiropractic care. I would imagine you're versed on what people would normally think a chiropractor can do. If I want to stroll in there and have you crack my neck, I'm guessing you can do that.
Yep, I'd want to do an exam first, and then definitely if there was anything, like if we needed to get some x-rays or anything to see what your spine looked like, those are all valuable things. So that would happen before the adjustment, but I can't. Yep, that's the main thing that I can do is that adjustment.
Now, one thing that Dr. Meyer said, one of the main emphases that you work on is flexibility and mobility. Now, what does that mean?
Yeah, so I think flexibility, mobility would be like your complete range of motion. So each one of your body parts should be able to move to a certain degree. And I truly think if you're limited in that range of motion, you can actually improve that. So my goal is to help people really see what is capable of themselves, and then get them moving in the right direction. And it doesn't happen overnight, but if you start working on yourself and start stretching those tissues, you can make some big changes over time. So
anything with healthcare, I think that's maybe as a consumer, for lack of a better term, we somehow got sucked into, I want to walk in, give me one pill or give me one adjustment and heal me. It's not how it works, whether it be your medical care, whether it be your diet, changing from mega processed food to a different way of eating, to chiropractic care. It's not necessarily going to be fixed in one day.
No, and I'm not diminishing the chiropractic or really anything. I've seen some big changes with one adjustment.
Right.
But really what I'm looking at is I want you to be healthy at the age you're at, but let's look into the future. Let's set some goals. When you get older, one of the main things that I'm helping people with is just sitting and standing. Those are important things to be able to hone in on.
So before we went on air, I told you some of my difficulties, and so let's use me as an example.
Awesome.
So, like, if I go mow the yard, maybe not so much mow the yard, but if I'm out doing a half a day's work, going up and down a ladder, painting on the house, or even if I go out and play a round of golf, my lower back is just screaming at me like, I am so sore. Why did you do this to me?
Yeah. So I would really want to do an exam on you first. That would tell me a lot about what's going on. But just I can see the position you're sitting in, which most people can't see it right now.
Right.
So I know where you're maybe weak at because those muscles are stretched out. So for you, there's a couple stretches that I would give you specifically just because you're in a seated position most of the time. And that's a lot of us. Really anybody who has to sit for more than 5 to, some people are sitting 8 to 10 hours a day.
Oh, sure.
So think about that. You're sitting there for that amount of time. Muscles are shortening up. They're staying short, so we just need to even them out.
So instead of going about halfway through that workload, and you can feel it tense up, you can feel I'm already getting tense, and I will tell my wife, I'll tell Lene, I'll say, well, I may as well go ahead and take the ibuprofen now.
Yeah.
Yep. And so that's the road you go down.
I'm really glad you brought that up. So that's a big one. You want to be really careful with taking painkillers, especially like ibuprofen and that type of stuff, frequently, because it has other effects on your body too, and your body still has to get rid of those things. And even deeper than that, I think one thing that I see that's very valuable is actually those pain signals that your body is telling you. Those are important. Those tell us, they tell me what is going on. It helps us figure out kind of where things are maybe too tight or maybe are dysfunctional. So you don't want to numb those out. I think that there's actually there's some people in this world that have a disease where they can't feel pain receptors, and they're hurting themselves frequently. And so those are actually, I think, something that we can listen to. Obviously, we're trying to get rid of pain. We should be pain-free. That's my goal for everybody, is to be pain-free so you can do what you want to do. But let's take a step back and listen to what those pain signals are telling us, and then go from there.
So I should be receptive to those signals instead of trying to mask them. I should be receptive, be happy I'm getting them, and try and get to the root cause and fix it.
Yep, I got to be really careful because there's some chronic pain issues where people really have a hard time getting out of pain, and there's some other tools at the clinic that we have for that. But I think that those pain signals are something that we should listen to. They're arrows. They help us figure out what's going on.
All right, well, we are out of time. I got to let you go. Yeah. But just in a nutshell, as being the chiropractor on board at Okoboji Wellness Clinic, working with a host of team members, great team members at Okoboji Wellness Clinic, just in a little sentence or two, describe what you think Okoboji Wellness Clinic is all about and why you feel good to be a team member there.
Yeah, so I would say it's patient-centered. So the patient that's our goal. Our goal is to get the patient healthier, to help them along their health journey. So we have so many parts to the clinic that that's one of the things that's exciting for me is we're learning how to get people started in health, how to get them momentum with health. And I just feel like we care about people. Not to say other people don't care, but I just know that's one thing that we're good at.
Well, and with the different team members that you have at Okoboji Wellness Clinic, it allows for a great opportunity to collaborate.
Yeah.
It's like, hey, I have this case. What do you think?
Well, we're right next to each other, rubbing shoulders. So
Yeah.
I've worked in a couple different clinic capacities where you'd refer out to different places, and we still do that. But it's just really nice to be able to be right there.
Well, it's great to meet you. Thanks for coming
Good to
in
meet you.
studio.
Yeah,
That's
thank you.
Dr. Nick Larson, chiropractor at Okoboji Wellness Clinic. So pleased to have him with us in studio today, and one of the team members at Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com. And, of course, you can give them a call, 712-339-6024, or visit them at 3305 Burquist Avenue in Spirit Lake. They're very easy to find. They have an amazing facility. That's Okoboji Wellness Clinic.